Disclaimer. This podcast is for educational purposes only and is not medical advice. Always consult with a qualified healthcare provider before making any decisions about your health, supplements, or peptide use. Today we are going to explore PE-22-28, a peptide that has been drawing attention in research circles for its potential effects on mood, cognition, and neurological health. To understand where PE-22-28 fits in, we first need to think about peptides in general. Peptides are short chains of amino acids that can act as signaling molecules in the body. They are like small keys that fit into specific locks on cells, triggering different responses. PE-22-28 is a synthetic peptide derived from a portion of a larger protein found in the nervous system. Its sequence was designed based on natural fragments thought to influence brain signaling. The main interest around PE-22-28 lies in its ability to interact with pathways involved in anxiety, depression, and memory. Researchers began to investigate whether this small fragment could stabilize mood or improve learning processes without some of the harsh side effects that come with pharmaceutical drugs. So, how does it work? The proposed mechanism involves modulation of neurotransmitter systems, especially serotonin and dopamine. These are the brain's messengers that heavily influence how we feel, how we focus, and how we respond to stress. When balance is lost, depression or anxiety may arise. The idea is that PE-22-28 could help restore balance by supporting healthier communication between neurons. Animal studies have been a big part of what we know so far. In rodent models, PE-22-28 has been linked to reduced anxiety-like behavior, enhanced memory retention in maze tests, and even antidepressant-like activity. These effects appear to come without sedation, which is a limitation in many medications. This raises the question of whether it could eventually translate into a tool for humans. Another fascinating aspect is its potential neuroprotective effects. Researchers speculate that PE-22-28 may help shield neurons from stress-induced damage. Chronic stress is known to shrink certain brain regions, like the hippocampus, which plays a critical role in learning and memory. If a peptide can reduce this damage, it could open doors for supporting cognitive health during aging or in neurological disorders. Delivery methods are always a big discussion with peptides. Because peptides are fragile chains, swallowing them often destroys them in the stomach. With PE-22-28, experimental delivery has mostly been by injection or nasal spray. Nasal administration is especially intriguing because it allows direct access to the brain through the olfactory region, bypassing some of the challenges of digestion and liver breakdown. Of course, with all this promise, we have to remind ourselves that human data is extremely limited. The bulk of information remains preclinical, meaning in animal studies or lab settings. That means we cannot make firm conclusions yet about safety, effectiveness, or dosing for people. The peptide research world is always moving fast, but responsible exploration requires caution. Let's think about real-world applications people are curious about. Some wonder if PE-22-28 might be useful for anxiety that doesn't respond well to traditional treatments. Others look at it as a potential nootropic, a brain-boosting compound that could sharpen focus or memory. There is even speculation about its role in post-traumatic stress disorder, where rebalancing brain signaling is often a challenge. Another area of speculation is aging. As we grow older, memory decline and mood fluctuations often overlap with changes in neurotransmitter activity. If PE-22-28 truly supports healthy signaling in the brain, it could one day be positioned as part of an anti-aging or cognitive support strategy. But again, this is far from proven, and careful human trials would be necessary before any real claims could be made. One thing to highlight is how PE-22-28 compares with other peptides. For instance, Semax and Selank are also small peptides studied in Russia for their effects on mood and cognition. They share a similar focus on stress reduction, memory improvement, and neuroprotection. But PE-22-28 appears to have its own unique mechanism, giving it a separate place in the growing family of neuroactive peptides. Side effects are still largely unknown. In preclinical work, the peptide was well tolerated, with little to no toxicity reported. But until larger human studies are conducted, we cannot say with certainty what risks exist. Peptides can sometimes cause immune reactions, local irritation, or unexpected hormonal effects, depending on their structure. That's why responsible research and professional guidance are critical. Another important part of the story is legality and accessibility. Many peptides are considered research only and not approved for clinical use. Depending on location, obtaining them may fall into gray areas of regulation. That means consumers should be extremely cautious about sourcing and avoid anything that seems unreliable or unsafe. Let's zoom out for a moment and reflect on what PE-22-28 represents. It shows how researchers are moving toward precision molecules, trying to design tiny fragments that can influence very specific pathways in the brain. Instead of one drug that hits multiple receptors and causes multiple side effects, the hope is for targeted peptides that fine-tune single systems. Imagine a future where conditions like anxiety, depression, memory loss, or even neurodegenerative diseases could be managed with small custom peptides designed for each person's needs. While that future is not here yet, PE-22-28 is one of the experimental steps in that direction. Now, let's spend some time imagining what a user might experience if PE-22-28 ever became available in clinical practice. Someone dealing with chronic anxiety might notice calmer mood without the drowsiness of standard medications. A person struggling with focus or memory might feel sharper during the day. And someone under heavy stress might find they bounce back more quickly, protecting their long-term brain health. Again, this is speculation, but it illustrates the potential vision that excites researchers. Critics argue that without strong human trials, peptides like PE-22-28 remain more hype than help. They warn that placebo effects, lack of dosing standards, and unknown risks could overshadow any benefits. These are valid points. Science must move carefully, and that balance of curiosity and caution is what drives progress. Supporters counter that many groundbreaking treatments started with small fragments of promising data. Without early exploration, we wouldn't have many of the therapies we rely on today. They see PE-22-28 as another candidate worthy of continued investigation, particularly because of its novel structure and potential to cross into areas where current drugs fall short. As with all peptides, education and patience are key. Knowing the background, The science and the limitations helps us avoid exaggerated claims and instead focus on the real possibilities. If PE-22-28 continues to show promise, we may one day see it move from lab bench to clinic. Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult with a qualified healthcare provider before making any decisions about your health, supplements, or peptide use. Thanks for listening. Keep learning and stay curious.